Choice, oh, na baby by chance. Baby by choice, oh, na baby by chance. Don't become a parent before your time. Never become a parent before your time. You suffer too much and regret in life. You kill your dreams and expectations of becoming a better person. So to protect your future and live a happier life, prevent yourself and stop wanting too soon. Preventative care can be given to you by healthcare providers and the nurses at the clinics. A very pleasant good morning. Welcome to another informative and educative edition of the program brought Way to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower you about health-related matters. Well, today is December 30th, 2025, and driving you through this edition of the program are Angela Noah and
Melvin Stewart.
and of course, we are joined by AB Salif and Emmanuel C. George, who are here taking us live. AB through the ministry's official Facebook page and Emmanuel through ELBC Angle. So, however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, we'd like to encourage you this morning to like and share the live stream. Invite a friend to watch along with you. And to our dedicated radio listeners, to say thanks for always joining us on this program. Well, this morning we have invited in studio the Diagnostic Division of the Ministry of Health. That's the National Diagnostic Division of the Ministry of Health, represented here by two expert guests this morning who are set to take us through diagnostic services being provided by the Ministry of Health across the counties, where impacting the lives of citizens in all ways possible. So stay with us as we take a very short break to be back. Oh, na baby by chance. Baby by choice, oh, na baby by chance. Don't become a parent before your time. Never become a parent. Welcome back and thanks for rejoining us. Well, this morning we have invited Dr. Jonathan N. Parker, the Director of National Diagnostics Division at the Ministry of Health, and Mr. Prince P. Bondi, Quality Manager, National Diagnostics Division of the Ministry of Health. Before we join our guests this morning, well, firstly, let me greet my colleague Melvin. Melvin, good morning.
Good morning, Angel, and good morning, everyone.
Happy New Year. I feel like we are already into the new year, so it's
Yeah,
good to be here with you on the final episode of 2025.
yes, of course. And we want to be thankful to God Almighty for allowing us to see today is the 30th, and we already, gone down the journey. Hope that we can see 2026 on Thursday, and hope that we go to church.
Of course. And for me, I'm very sure I will see 2026 and
Yeah,
so many years to come, though.
of course.
Yes, so Melvin, welcome our guest this morning.
Yes, let me welcome Mr. Prince P. Bonding. Prince, good morning and welcome to Roadway to Health.
Good morning. Thank you so much.
Da, Dr. Jonathan N. Bakai. Morning, sir.
Yeah, good morning, Melvin. Nice to meet you. Um, I wish you Happy New Year. Like Injo said, we now feeling like we already in the New Year.
Thank you. Good having you both here today. And let's begin the conversation with Mr. Bowden. Just talk to the public. Just explain a bit about yourself. Who are you, and where specifically do you work? What are your engagements?
Thank you so much. My name is Prince Bondi. I'm a medical laboratory technologist. I work with Ministry of Health for the past 9 years now in the health services. I started at detention hospitals as laboratory technicians, later on become a lab supervisor. And also while I've been working with Ministry of Health from the time of the Ebola crisis up to present into 2021. I was invited at the Ministry of Health to work at the central office as a laboratory quality manager. So I work with my director, in the division to ensure that all our health services when it comes to laboratory services, our police are in the field at the various countries. We work closely with them through partners, through the ministry, to ensure that they are able to provide the best of all for patients in improvement at the various hospitals in Liberia.
Okay, Dr. Parker.
Okay, thank you very much. I'm Dr. Jonathan Mbaka. I started in the health sector from 2005, so I've been around for a little over 20 years. But I started off as a laboratory technician training at the Mother Patern College of Health Sciences. And then later I will go on to become a medical doctor and study at the AMWT College of Medicine. But again, during the Ebola crisis, I was still in med school when we were confronted with the deadly Ebola. I had to come out as a medical student and call on to serve in the diagnostic field. So I was assigned at the Jackson Hebdo molecular lab where we're basically testing Ebola virus.
Okay.
And then after that, I graduated from the medical school and also found it fit to go into biomedical research. So I went to the University of Ghana and did my master's in molecular cell biology, and later went to Brown University in the US where I did my research. And then back to the Ministry of Health after I completed, and I was assigned to the National Diagnostic Division, and I've been in the division for the past almost 5 years. And it's good now that I serve as director and helping to steer the affairs of the division, making sure that we improve diagnostic services across the country. Thank you.
Congratulations. So, when did you take over as director?
So I took over as the director in July, but before then I have served as the deputy director for technical services.
Okay. Okay, so today we are talking about the diagnostic services being provided by the Ministry of Health across counties, impacting the lives of citizens. But before we deepen our discussion into that, you know, this is our first time coming on here to talk about diagnostic services. And now people listening know that the Ministry of Health has diagnostic division existing. So let's, take a step back into history, beginning with the establishment of the National Diagnostic Division. What led to its establishment? I mean, what are the specific issues it was established, to deal with?
Okay. Firstly, we note that diagnosis play a major role in patient care. With all diagnosis, the work of the medical doctor is very difficult. It's almost like you are guessing. So, in 2009, although it came very late on, but in 2009, the National Diagnostic Unit, but then it was the National Diagnostic Unit, was established in the Ministry of Health. And the major role was to oversee diagnostic services, help guide the Ministry of Health in improving diagnostic services across the country. As we were confronted with the Ebola crisis, it exposed the health sector and interestingly also exposed the diagnostic division.
Okay.
It showed how weakened the diagnostic division was, and there was a need to improve that division. So working along with partners, the unit was elevated to a division in 2016 with the goal of improving diagnostic services. The major role is to oversee all diagnostic services across the country with responsibility for ensuring that there's diagnostic practices across laboratories in the country. We also have our responsibility to ensure that the quality management system and best practices across all of the labs in Liberia is practiced.
2016, you began. I mean, you started real. I mean, operations because you said Ebola exposed the weaknesses that were associated with the National Diagnostic Division or under the Ministry of Health. Now, 2014, Ebola hit Liberia. In 2016, you begin very vigilant in the dispatch of your manpower, of your technicians across all diagnostic centers. Tell us exactly when you took over and looking at the weaknesses, where were those specific areas you focus on to make it more like balance in terms of providing all of the necessary diagnostic services?
Okay, so in 2016, a little after the Ebola subsided, our international partners working along with the Ministry of Health saw the need to improve the diagnostic division. So major focus was on the quality management system, but then Liberia has not been practicing the quality management system. So the quality management system was introduced in Liberia, although other countries have been practicing the quality management system. So the quality management system is just a structural framework that help guide laboratories to provide accurate, reliable, and timely results, taking into consideration international standards. And there are 12 essential elements, and those elements cut across the infrastructure of the lab, making sure the lab design is appropriate and adequate, looking at equipment, looking at personnel, the safety of personnel, because we know during the Ebola crisis, a lot of our colleagues got infected and died because of the Ebola. And the quality management system also takes into consideration the facility, customer satisfaction, and that standard has even been revised and it is now more patient-centered. So that's where we've been heading and leading the division and the laboratory sector in the country, making sure that we implement the quality management system and get the best results for our patients and for the country.
Go ahead, Melvin.
Let's hear from Mr. Bowden. You listen to Dr. Baka, and you guys a specific role playing at the Ministry of Health. Just tell us how collaborative is your office with the office of the director?
Thank you. It's the same office, working within the same decision.
Yeah.
He's my boss. So as you rightly said, before 2024, things was not all right. But after the Ebola crisis coming from 2016 onward with the establishment of the unit, from unit to division now. So as Dr. Waka rightly said, the unit worked down as overseeing the laboratory services in the country is also there to provide the rightful guidance in terms of policy documents that will, structure the health sector in a perspective. And in terms of policy document are those requirements that the laboratory need to meet up with in the country, as Rebecca said, in terms of infrastructure, in terms of human resource capacity that need to be built, the requirements of different equipment within the lab, that people need, that our colleagues, our technicians, we need to work with it. Those requirements have been specified based upon the type of health center. If you have the clinic, you have the hospitals, you have the from clinic to health center to that of the county hospitals, those different hospitals, they are specified equipment and testing capacity that you need to meet up with. So part of the unit depending to lay this layer so that what can be done at the clinic be done there, what should not be done at the clinic should not be done there, they be done at the health center or at the district or at the county and at the national referendum. So these divisions of work is what the ministry have been doing to ensure that we have the divisions of work we put in place so that we can have a smooth operation of diagnosis in the country.
So you are talking about policies that guide, the implementation process, right? I'm concerned. Do you also extend it to private health facilities, or is it limited to government-run facilities? Let's provide that clarity.
Yes, that also come in the national policy for life services in Liberia across everyone. In fact, when we're doing the right thing, we invite all the private health sectors and we all do it together. And once are being endorsed and signed by the ministry, it cover everybody. Even the support that the doctor said about the laboratory quality management system implementation, we have private facilities that we are also enrolled into the program. And most of the equipment that we are currently using, some of it are being extended to the private facility as well for service delivery. So we are also supporting the private sector as well.
I know Doug will come in, but let me ask this question. You, in terms of all of what you do with the revamping of your service delivery across Liberia, can we safely say that we are on speed with other countries around in the sub-region?
Yes. We are on speed. Currently, right now in our country, uh, almost all of the county hospitals, right? They have been supported with the latest state-of-the-art equipment, including the biochemistry analyzer, hematology analyzer for service delivery at the county. Other molecular equipments are being supplied to all of the health centers, especially in the county hospitals and major hospitals, where patients samples will not need to be moved from one county to another county for clinical samples, except public health disease of concern that might be transferred to the National Reference Lab. But other clinical samples, in terms of movement, is about to be reduced. So we are actually on path with our region here. And most of our health sector, as Darrell said, they are being rolled into the ISO 15189. It's a standard for laboratory best practices. So all our county hospitals, some of the health centers, private hospitals have been enrolled into that. And it's our wish that even the most few of the private sector yet to be enrolled, but as we work closely with them to be enrolled. So we are on path with our police in the region.
Having the equipment is just one aspect. I know we will go delve into how the training of manpower is being conducted. But I'm keen to note if you have this equipment coming to country and you have government pumping more money into them, looking at the electricity power supply, because most of these equipment work along with current.
Yes,
Do you also take into consideration that?
exactly.
Yeah, so the concern with the equipment been addressed. So, like before this time, in 2023, we did an assessment across the country, looking at the essential package of health services and the different tests that should be done at the different levels. But our focus was on the county referral hospitals. And we saw that most of the tests that they should be provided at that level was lacking. Most of the facilities could not do complete blood count. Most of the facilities could not do biochemistry. Most of them lacked the basic tests. In fact, at one point, the report was so scary to the extent that a decision needed to be taken. In fact, for the whole western part of the country, there were no biochemistry analyzer. That means citizens in that portion of the country were actually denied basic health care. So what we did with this senior management under the leadership of our minister and the CMO was to procure analyzers, and we targeted county hospitals and district hospitals. So as the quality manager said, we can now boast that all of our major hospitals have equipment, state-of-the-art CBC analyzer, biochemistry analyzer, urine analyzer, water bath, and we also brought in the newest gene expert technology. The gene expert is very important in our fight against HIV and TB. We get them deployed in most of our facilities around the country. We brought state of the art, the newest 10-color gene expert. Now we can even detect and resistant TB. So with the issue of electricity, we are addressing that. The laboratories need to be running 24/7. So the way we're addressing that currently, as I speak, we are providing solar for all of our major hospital laboratories in the country. As I speak right now, the team is in Israel at the Martha Tubman Hospital, carrying on the installation of the solar panels. So in the next few weeks, we'll have all of our labs running on solar in addition to the standby generator and the national grid for those that have AIC.
So you're already on the interventions that are being carried out. So let's just continue with that to outline all of the interventions and how exactly each of them are impacting the lives of citizens.
Okay, so the first major intervention, like I said, the quality management system, which has all of the main components in it. We want to make sure that the laboratories have their documents and their SOPs, the standard operating procedures, because any work you do in the lab has to be documented. So the quality management system, like I said, is a structure framework that ensures the lab produce quality results, and it goes from sample collection all the way to the release of results. So all the processes that should be followed, we make sure that the lab technicians follow those processes. And we train them to the quality management system. We've been doing a lot of training. We've trained even more than 50% of all of the laboratory staff in country on the quality management system.
Nationally or internationally?
Nationally.
Okay.
We've even brought in international trainers to train them. So I know there was a question on how do you compare our laboratory system with other countries in the region.
Mm-hmm.
But I can tell you that our laboratory system is on par with our West African and regional countries. I a few months ago attended the laboratory director meeting, and when you sit in those kinds of meetings and discussions are taking place on how laboratory services are being run in other countries, you compare to what you're doing in your country, you know that you are making progress. Although the progress is coming a little slowly, but we are getting there.
Okay, so let's talk about the management or the quality management of those equipment that are being donated to facilitate maintenance and all of that. How do you ensure that those equipments are maintained, taking into consideration reporting and all that?
Okay, so firstly, when we procure those equipment, we make sure the vendor will go and install the equipment. And during that installation, each county has a biomedical engineer. So the biomedical engineer has to be part of that installation, and the laboratory staff who are going to operate that piece of equipment will also have to be trained. And training record has to be submitted to the National Diagnostic Division to make sure that that job is completed. And then the staff are also trained on doing preventive maintenance, that is daily cleaning of the equipment, weekly cleaning, monitoring that the equipment is functioning better. If for any reason there is a breakdown in the equipment, the biomedical engineer at the county level is first consulted to go and examine the equipment. If the work is beyond the county level, then that equipment is either brought to the Ministry of Health at the Healthcare Technology Management Unit, the HTMU. We also have highly trained professionals that can repair those equipment. But making sure that our staff are trained to properly handle the equipment, operate the equipment safely, conduct preventive maintenance, are all ways that we're ensuring that the equipment remain healthy and function very well.
Okay, so let's hear from you, Mr. Bolton. You want to add to what you said?
Thank you. So, to add a little bit, as you already said, in terms of ensuring that our equipments are well maintained, currently, as we speak, we are working along with the Global Fund, where 30 pieces of air conditions are being procured, and installation will soon start at all the major hospitals where they have received those equipment. Although they have an existing air conditioner there, but we want to, reinforce it because those equipment with the good environment conditions, the equipment can last very long. So that was ongoing as well in the right now to our prayer facility as well.
Okay.
And additional with UPS, that will also support the equipment in case there's a current situation has to be brought to go off. The UPS can assist to maintain the equipment operating in the next few minutes, hours while current is coming on. So these are things we are doing to ensure that our equipment lasts spans like long lasting.
So we have about 15 counties across Liberia, and across these 15 counties, we have health facilities, huge number of facilities existing in each of them. And you are providing diagnostic services across the entire country. You have facilities needing something, the other facility needing, with the huge number of facilities that we have. How do you go about with the implementation process, making sure that all facilities benefit? Just the process.
Yeah, so at the county level, we have county diagnostic officers. So every county has a county diagnostic officer. So these county diagnostic officers are responsible to oversee laboratory services at the county level. So they also help to reduce the burden from on us. But then once it's above their control, it has to come to national. And good thing is that we have highly qualified staff, operation manager, supply chain manager, who ensure that as soon as we receive complaints from the county on supplies, we are able to make contact with the central medicine store. When supplies are in stock, we send them. If it is emergency supply, we are able to make emergency supply available to facilities around the country. We also use the quarterly supply chain management to also send supplies to the county depots. So at the county depots, we have supplies that are also stored there just in case, and county diagnostic officers can request for them, and the lab supervisors can also request for them. So that's the way we work to make sure that the system moves smoothly.
So, Melvin, you want to come in? Okay. So, apart from other strategies that you've already highlighted, what other strategies, the key strategies, the National Diagnostic Division is implementing, to improve diagnostic services across the country?
Okay, so another thing we are doing is to improve our human resource capacity. So, as I said earlier, we've been training our laboratory staff, and not only in the quality management system, we've provided biorisk management training for them, considering, like I said, it's not good to go back to the data past, but we have to prepare. You don't know when we're going to have the next pandemic or the next epidemic in Liberia. So we don't want our staff to get infected in such a situation. So we've been providing biorisk management training for laboratory staff. We've also been providing biosafety, biosecurity training for laboratory staff. We've trained more than 100 of our staff in biorisk management and biosecurity and biosafety. Just in fact, a few weeks ago, there was a training encounter where we invited seniors from the National Fire Service, and they came and helped our staff through demonstration how to use the fire extinguisher, fire drills, and what staff can do in the lab when there is a situation of fire. That was a very, very important training, and we hope to get more support to roll out that training to more of our staff. So that's the way we've been building our staff capacity. In fact, most of the researchers also say that most of our staff are laboratory aides. Okay, and more than 50% of the staff in the labs are laboratory aides. But what we are doing as a ministry and as a division is to upgrade those staff. So in the next few weeks, we've already selected 75 laboratory aides who are coming to Mola Pattern College of Health Sciences and the Phoebe Training Institution to upgrade them from laboratory aide to laboratory assistant.
Okay.
Yeah, so the first 75 will come and get that upgrade training, and they will sign a MOU with the Ministry of Health. In fact, these are staff who are already working in the facility. We just want to upgrade them, but they will sign a memorandum of understanding with the ministry to go back to the facilities and serve. We don't want to train people and then they leave. And we hope that we can get additional funding to train more of these lab aides and upgrade them.
Okay.
But there is a shortage of laboratory technicians. So our overall goal is to also upgrade the laboratory assistant that we have in the sector up to laboratory technician. And if employment opportunities come, we will also employ more laboratory technicians. But what we've been doing, what we're doing currently with employment is to absorb the volunteers,
Okay.
the lab volunteers. We have lab aid, lab assistant, lab technicians who've been volunteering in the facilities for years. You know, it is difficult to implement a quality management system when you depend on volunteers.
Yeah.
They come when they want to come. They do as much they can do. You can push them beyond doing what they can do. So the minister asked us to submit the names of the volunteers.
Okay.
We submitted all of the names, and
How many
we submitted names of over 200 lab volunteers
across the country?
across the country. So they've been processed. They fill in the form submitted to the HR department. So they've been processed, and hopefully, in fact, even before this, some of them were processed at the beginning of the year, and
They are now civil servants.
yes, and more of them have now been processed to get on the payroll.
What do you want to achieve? Because if you can have 200 plus volunteers, their names have been submitted for processing to be a full civil servants, what do you want to achieve, Dr. Baka? What do you want to see?
That's a very important question. Our vision is to ensure that our people receive the best laboratory services. And to provide the best services, you need qualified laboratory staff. You need the best equipment. You need supplies. You need to make sure your staff are motivated. And these are things that we've been working towards. We're working to make sure that state-of-the-art equipment are available. We have the gene expert. Recently, we brought in AI X-ray.
Okay.
These are sophisticated X-ray technology. We do the X-ray, the artificial intelligence helps to diagnose the case. So we want to make sure that our labs are at the level where they reach international accreditation. So those labs that are being enrolled in the quality management system, all right? We have mentors that are assigned in those labs, making sure that the right things are in the right places, the right procedures are followed. And then our national staff also provide mentorship and do periodic audit of the labs. So they always will tell whether the labs are making progress in the quality management system. So when you go, you audit the lab from the beginning. There are points that they score for every progress they make.
Okay.
And then they get to 1 star, they get to 2 stars, until they get to 5 star. And once you get to 5 star, then you reach the point where you can be accredited. Then we call international assessor to come assess the lab. And once you pass, you are accredited. So we want to make sure we have accredited lab in Liberia. Right now, we've enrolled 3 labs under the African Society for Laboratory Medicine for accreditation. That is the J.J. Dawson, the Phoebe Hospital Lab, and the G.W. Harley. These are very good labs. You go to J.J. Dawson, the lab is well organized, a lot of sophisticated equipment. I know a lot of people don't go to public facilities because they feel the labs are not good.
Yeah, they are
say,
substandard.
I'd rather go to the private facilities, but the narratives are changing.
Okay.
You can now go to the public facilities and get the best diagnostic services.
Okay. Are we also taking into consideration the laboratory infrastructure, especially in rural communities?
Yes. We also been upgrading laboratory infrastructure. So GW Hardy Lab was renovated, and that lab is one of the state-of-the-art lab we have in the country. J.J. Dawson, like I said, with the support of the U.S. CDC, the U.S. government, that lab was extended also, and that lab has also been prepared in the case where we have maybe another outbreak. You don't have to transport samples all the way from the southeast to the National Reference Lab in Charlesville. So samples can be taken right to J.J. Dawson and be tested. So we're trying to improve the other labs around the country too, the regional labs, so that we don't move samples from, imagine what it takes to move samples from Maryland County all the way to the National Reference Lab located in Charlesville at the back of the Liberia International Airport. Imagine you have to transport samples from all the way Lofa to the National Reference Lab. It takes a lot of time, longer turnaround time. The patients will be waiting. It takes time before they even get the results. The clinicians need to make the decision. They have to wait. It takes a lot of time. So another thing we've been doing, as you know, in the president's first State of the Nation address, his target for diagnostic services is to ensure that we have regional diagnostic centers. So the first regional diagnostic center is now going up. If you go to Bon County, Bellefontaine, the building is going up. That building, that diagnostic center is going to be state of the art. It's going to have all of the best diagnostic technologies, modern technology from the biochemistry analyzers. They're going to have CT scan, MRI, and all of that. So, and after that, we will also be extending the diagnostic centers to other regions in the country. So,
you are taking infrastructure.
Yeah. So in few years, I can assure you that diagnostic services will be at a complete different level.
And I know all of these things you are doing under your watch. I know all bows down with the innovation of the Minister of Health. But let's look at how you get your funding under the Ministry of Health. What is your budget line?
Yeah, so we have a dedicated budget line under the Ministry of Health for laboratory consumables. And in fact, with the vision of the minister. Okay, when she took over, her instruction was to make sure we use that budget line to procure laboratory consumables.
Okay.
And all of what we have in that on that budget line was used for procuring laboratory consumables. So all of the state-of-the-art equipment you see in the facilities around the country, ones that you find on the Ministry of Health and Facebook page, they were not procured by partners. They were procured by the governor of Liberia through the Ministry of Health. So that shows the vision of the minister, the CMO. In fact, when the CMO came on, our first meeting with the senior management is that she doesn't want to leave the diagnostic services in the same position that
She made it.
she met it. So she has been very, very supportive of the laboratory division. Every week she makes sure that we provide her update on what we're doing, and when she visits facilities around the country, imagine the minister was in Lofa when she went Lofa a few months ago. As she was touring facilities, she will be right at the facilities and call me, Tata Baka, this facility needs this and that. You have to come and assess this facility. In fact, I just came from Lofa last week, assessing and do on a need assessment for those facilities that the minister visited to see how we can improve the diagnostic services. These are clinics. I know currently our focus has been more on improving the hospitals, the county hospitals, the district hospitals, but gradually we'll move down to the clinics, make sure, because most of our people also seek care at the clinics. But at the clinic, we can't do much. Like the quality manager said, there are testing menus that we define as the National Diagnostic Division. There are certain tests that can be done at the clinic level, at the health center level, at the hospital level. So we're just trying to make sure we provide these tests that should be done at the clinic level. Tests that cannot be done at the clinic level, we are strengthening the specimen transport system so that these samples can be moved. So you don't want to move the patient in most cases because it's expensive, but it's less expensive if you move the samples. Yeah. So we've been trying to strengthen the specimen transport system, empowering the district health officers, the district surveillance officers to respond to specimen transport. So once the samples are collected, you call on them, they pick the sample and move it to the next or to the nearest facility that can provide that diagnostic services and return the result.
Okay.
Yeah.
We can just hear from Mr. Bowden maybe from 1 minute, then we'll take few calls quickly across the country. Yes, sir.
So thank you so much. That I respond to most of the questions. The question asks, what do you want to see? Looking at we want to employ more staff in the facility. As you already said, part of the requirement within the laboratory quality management system implementations, one the period there is customer satisfaction, right? And looking at it, we don't want for patients to go at the hospitals to overstay the time that they need to spend at the lab. And if you have less number of persons at the lab testing, number of patients that go to the hospitals, almost all of the patients pass in the lab. So if you have 4 or 5 doctors, 10, 15 doctors screening a patient and sending them for testing in the lab, you will get 2 or 3 persons. Just imagine how the 2 or 3 persons, be able to cater to all of these number of patients are going. And at the same time, some people are admitted on the ward. The same time need to go on the ward to go collect samples and analyze. At the same time, some people need to get results that same day and return. So you just imagine how it's not easy to have 1 or 2 or 3 persons in the lab to cater to all of these patients that come to the hospital. So our visions, as we rightly say, is to ensure that we have adequate number of staff as per the national standard lab policy document, that This number doesn't require us starting to get a clinic at the hospital so that when patients who go to the hospital can be admitted with timely testings at these facilities.
Oh,
All right.
okay.
Angel, let's take a few calls.
Okay, before you take the course, let me also let you know the support that we are receiving from our partners.
Okay.
Okay, the laboratory partners who are strongly supporting laboratory services in Liberia. Okay, the WHO, the WHO is everywhere, supporting diagnosis, supporting surveillance and everything. The US CDC is also very supportive of the laboratory system. The US government, it used to be US ARD, but now it is the US government.
Okay.
The US government is also supporting most of the diagnostic activities. One of our biggest funder is also the Global Fund. So the Global Fund, the solarization we talked about, gene experts, supporting the gene expert, most of these support coming from the Global Fund. In fact, under the Global Fund, we are procuring additional equipment. A lot of facilities have been calling for equipment, but we want to ensure that everywhere there is a doctor, we should have equipment. FHRTD system also very supportive. They are supporting the lab very strongly. RCF macro, we have a very strong team behind us. Thank you.
Yeah.
So we will take few calls because we gone out of time.
Of
Are you a
course.
lecturer?
You are sounding more.
Yeah.
Yeah, so improving diagnostic services in Liberia, we are certainly getting there. If you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health, and we are in talks this morning with Dr. Parker and Mr. Bodie from the Diagnostic Division of the Ministry of Health. To be a part of this conversation this morning, you've been listening, hearing all of the interventions being carried out by the Ministry of Health. It's only important that you make input this morning. So be a part of this discussion. You can call us on 0880-514-096, 0880-514-096, 0775-677-376, 0775-677-376 are the numbers to call. So let's take our first caller. Good morning.
Yeah, good morning.
Good morning. Your name and where do you join us from?
My name is Akane Yuma. I call from Green Basel County.
Let's hear you.
Let me say thanks to our boss, Dr. Parker, and also our quality manager, Prince Woody. Today, I must appreciate you guys so much for the level of what they are doing. And my biggest thanks goes to the President of the Republic of Liberia and the Minister of Health, who have seen laboratory as one of the key factors in driving the health force. With my county in Grand Basel County now, I can boast of the National Diagnostic Division with the Minister of Health, which have made our volunteers right now that we are not able to say that we have volunteers in Grand Basel County with the just recruited that just happened this just a few times. I'm so happy that today that Parker and the Ministry of Health have come in to interview and to help laboratory services in Grand Basel County and Liberia at large.
Thank you. We don't have time with you. Let's take few calls quickly. We are running out of time. Okay, this person is on the line. Good morning.
Good morning.
Morning. Please go ahead quickly.
Yeah, Kevin, this is Thomas Suleiman. I call you from Zubatown. Yeah, thank you for the conversation with them. For me, I really want to know what are those schools, because what we understand, Moropaten is the only laboratory school so far, and Moropaten can course many things, or when I say course many things up, many schools you go to here, we even want to be a laboratory technician, they will say they didn't get a permit, they didn't get in this, and what have you. Sometimes you go to the school, but to get a lesson, laboratory will come out the day, we get it, people here, and except Moropaten. Why if we are live far up here to be going to Moropaten, it's difficult to go there. So that's my issue. What are those schools? Do you know what?
Okay. Good morning.
Good morning.
Good morning. Your name and where do you join us from?
Miss Jiba Emana. I come from Central Monrovia currently.
Let's hear you quickly.
Yeah, and I I am also work with the Ministry of Health, and I'm so impressed to see that the National Diagnostic Division, with support from national government and Ministry of Health, has done so well in trying to improve diagnostic services in this country. Thank you to Dr. Parker and team. We are proud of the efforts made so far. I just want to quickly turn to police in the lab, because mind you, with all the investment, with all the strengthening efforts to the rural labs, the rural lab do not take care of those equipment. They will frustrate the ministry or the national government. What do I mean by this?
Sir,
Okay,
sir,
we don't
sir,
have
sir,
much
sir, no
time.
time. We take the last person. Morning. Okay. Let's take this last person from here. I'm sorry. We are out of time because seriously, we are out of time. So let's
Okay,
hear
sir.
from our guest quickly. We wrap up. The next program is right up my back.
Yeah, so I want to say thanks to the callers. I just want to address the issue from one of the callers on the mother pattern issue. So the laboratory board is responsible for licensing and accrediting institution. Although we work very closely with them, mother pattern, let's be very frank about that. Mother pattern is one of the best, okay, in training laboratory technicians in Liberia. But there are other institutions that are around the country that are also providing training for laboratory staff. I mentioned Phoebe, in fact, and TNIMA is also training laboratory technician. Nimba University also training laboratory technician. There is Sensors College in Wukiam also providing training for laboratory. So it's not only mother pattern.
Yes, sir. We don't have time. Just maybe 10 seconds. You wrap up. Then we get Boudin's parting comment.
Yeah. So my parting words would be: we just want to appreciate the Minister of Health and the senior management team at the ministry for the leadership in improving diagnostic services across the country. We appreciate the vision and the support they continue to give the National Diagnostic Division, and we're ready to work hard with our staff across the country to make sure our citizens receive the best diagnostic services.
Thank you. Boudin, no time, please.
Thank you so much. Wish one day we can have some of our lab being receiving international accreditations. That was the transition we're working on. So with the support of the military, we say thank you to our partner. And the Southeast, as the director said, PIH is doing well in the Southeast.
Okay.
So thank you as we close today. And guess what? Today's my birthday.
Happy birthday.
Happy birthday.
And tomorrow is my wedding anniversary.
Happy pre-wedding anniversary. Mr. and Mrs. Prince, Boudin, tomorrow is your wedding anniversary. Congratulations in advance.
Thank you so much.
Angel, just close up quickly.
Okay, so many thanks to the Minister of Health and her able deputies for, the commitment in improving diagnostic services across the country. Many thanks to our guests, Mr. Bondi and Dr. Parker, for sharing such valuable insights this morning. We have been your hosts here, Angela Noah and
Melvin Stewart.
Emmanuel and AB have been here taking us live. Until next Tuesday and next year, have yourself a good day.
Bye-bye.
Thank you.
That's Emmanuel was here, Manuel for